When you think of surgery today, you picture sterile rooms, precision tools, and merciful anesthesia, right? A highly skilled team ready to fix you up. But imagine going under the knife thousands of years ago. No pain meds, rusty tools, and a belief that evil spirits might be causing your ailment. Yet ancient surgeons performed operations so shocking, so seemingly impossible, that people actually survived them. Get ready, because the brutal, brilliant world of ancient surgery is about to blow your mind. Let's set the stage. The two biggest hurdles for any ancient surgeon were the terrifying lack of anesthesia and zero understanding of germs. Can you imagine someone cutting into you while you're fully awake, feeling everything? That was the reality for ancient patients. Pain management was rudimentary at best, maybe some alcohol, perhaps an herbal concoction, but nothing to truly knock you out. And then there's the invisible enemy, germs. Ancient doctors had no idea what caused infections. They didn't wash their hands, sterilize tools, or understand how dirty environments led to deadly complications. So every cut, every incision was a roll of the dice against infection. This makes their successes even more mind-boggling. Prepare yourself for this one. Ancient people were performing brain surgery. It's called trepanation, and it involved drilling, scraping, or cutting a hole directly into the skull. We've found thousands of trepan skulls from civilizations all over the world, from ancient Peru to Europe, dating back thousands of years. Why did they do it? For severe head injuries, to relieve pressure, for migraines, epilepsy, or even to release evil spirits believed to be causing madness. The shocking part? Many of these patients survived the procedure, and their skulls show clear signs of healing, meaning the bone grew back. This wasn't just a barbaric ritual. It was a complex, often successful surgical intervention, indicating a surprising knowledge of anatomy and procedure for the time. On the ancient battlefield, injury was common, and surgeons were often the last hope. They performed brutal procedures like amputations and had surprisingly advanced methods for wound care. A shattered limb from a sore blow or an arrow wound often meant amputation was the only way to save a life. It was agonizing, done with basic saws, and often with minimal pain relief. The patient would have to be held down by multiple strong men. But what's truly impressive is their wound management. Ancient Egyptians, Greeks, and Romans used sophisticated techniques like cleaning wounds with wine, an antiseptic, applying honey, a natural antibiotic, and using clean linen bandages. The Edwin Smith Papyrus, an ancient Egyptian medical text, details incredibly precise instructions for treating various wounds, showing a remarkable understanding of trauma. Broken bones were a constant threat in the ancient world, from falls to battle injuries. And ancient doctors were surprisingly adept at setting and healing fractures. Evidence from mummies and ancient skeletons shows clear signs of well-healed fractures, indicating successful alignment and immobilization. They use rigid splints made from wood, reeds, or even early plaster, much like modern casts, to keep the broken bone stable. The ancient Greek physician Hippocrates wrote extensively on fracture treatment, detailing complex techniques for reducing dislocations and setting broken limbs. This wasn't just guesswork. It was a practical, hands-on understanding of anatomy and the healing process that achieved impressive results. Beyond bones and brains, ancient surgeons were even attempting delicate procedures on the eye and for bladder stones. One of the most common causes of blindness in the ancient world was cataracts. Ancient surgeons, particularly in India and later in Rome, practiced couching. This involved using a needle to push the cloudy lens of the eye out of the field of vision, restoring some sight, albeit with significant risks. Another incredibly painful, but sometimes necessary, procedure was lithotomy, the removal of bladder stones. These stones could cause excruciating pain and block urination. Ancient surgeons developed methods to extract them, a testament to their surgical daring, even if the procedure itself was brutal. Survival was a testament to the patient's fortitude and the surgeon's skill. You might imagine crude, rusty knives, but many ancient surgical instruments were surprisingly sophisticated, well-crafted, and purpose-built. The Romans, especially their military surgeons, had extensive sets of bronze and iron tools designed for specific tasks. Scalpels for precise incisions, forceps for gripping, bone drills for trepanation, hooks for retracting tissue, and even cautery irons for stopping bleeding. These weren't just random sharp objects. Many of them bear a striking resemblance to modern surgical instruments, a testament to fundamental surgical principles that transcend millennia. Their design reflects a pragmatic understanding of anatomy and surgical needs, despite the limitations of their materials. While full anesthesia was a distant dream, ancient doctors did try to manage pain during these excruciating procedures. Opium, derived from the poppy, was known for its pain-relieving properties across many ancient cultures. Mandrake root, with its sedative effects, was also used, though it could be highly toxic. Alcohol was probably the most common immediate pain reliever, though its primary effect was often to dull consciousness rather than eliminate pain. Some ancient texts describe sleeping sponges soaked in concoctions of herbs like opium, mandrake, or hemlock, intended to be inhaled to induce a stupor. While far from modern anesthesia, these efforts show a compassionate desire to alleviate suffering, even if the methods were risky and unreliable. Who were these ancient surgeons? And what were their guiding principles? It was a mix of practical experience, philosophical observation, and sometimes a little superstition. In ancient Egypt, physician priests gained extensive knowledge through embalming and treating injuries. The Greeks, led by figures like Hippocrates, emphasized observation, experience, and the body's natural healing abilities. They established the foundational principles of medical ethics, including the Hippocratic Oath. Roman military surgeons honed their skills on the battlefield, gaining unparalleled experience in trauma care. And in ancient India, the physician Sushruta, often called the father of surgery, described incredibly detailed surgical procedures, including early forms of plastic surgery. It was a journey from trial and error to increasingly organized and sophisticated medical practice. So, the next time you hear about ancient surgery, remember it wasn't just barbaric. It was a testament to incredible human ingenuity, resilience, and a desperate, determined fight against disease and injury. What can we learn from these shocking procedures and surprising successes? First, the incredible resilience of the human body and spirit. Second, innovation born from necessity. And finally, that the foundations of modern medicine observation, practical skill, and a desire to heal were laid thousands of years ago in the most challenging of circumstances. It's a journey from gruesome grit to modern glory, reminding us just how far medical science has come, built on the foundations laid by these daring and determined ancient healers. Let me know in the comments below. If you enjoyed uncovering these ancient ways, make sure to hit that like button, subscribe to Ancient Ways Discovered, and ring that notification bell so you don't miss our next adventure into the past. We'll be diving into more incredible ancient secrets very soon.